is 3 different cases of rib fractures to compare. The first one is an example of acute rib fracture. A 40-year-old male fell downstairs and now complaining of pleuritic chest pain. So there is acute presentation here, chest pain after falling downstairs. Can you see this? So let's count. Let's count the ribs. So here, this is the first rib, normal. The second rib, normal. The third rib, also normal. First, second, third. The fourth rib, abnormal. Can you see this and this? There is a kind of stepping here. So the fourth rib here is fractured. Now the fifth rib, also there is a stepping of the fifth rib, stepping. Can you see this and this? So also there is fifth rib, right fifth rib fracture laterally. The sixth rib, can you see this? This stepping also means that we have here right, fourth, fifth, and sixth rib fractures laterally. And these are acute fractures. Why? Can you see this? There is associated pleural thickening, likely due to extrapleural hematoma. So these are acute rib fractures, and they are associated with pleural thickening, likely due to extrapleural hematoma. Management here I would compare with old films. Symptomatic management of the rib fracture. Repeat chest X-ray of increased breathlessness as there is increased risk of pneumothorax. The risk of pneumothorax is increased only in the acute rib fractures. So we need to repeat chest X-ray. If the patient has increased breathlessness, so he needs to attend the A&E. There is maybe a risk of pneumothorax development. Only in the acute case, acute rib fracture. Next case is an example of subacute rib fracture. 22-year-old male has chest pain after rugby injury 2 weeks ago. So this is not acute presentation. The chest pain started 2 weeks ago. Okay. This is the subacute. This is the subacute rib fracture. Okay. So let's count the ribs here. This is the first rib, normal. The second rib, normal. Third rib, normal. fourth rib normal, fifth rib normal, sixth rib normal, seventh rib, eighth rib. So the seventh rib here, there's kind of a stepping here. This is the seventh rib. What about the eighth rib? If you go like this, you can feel here that there is a kind of compression here, compression fracture. Okay, so the eighth rib is also fractured. Here is the stepping. This is the part of a stepping. So this patient has left eighth. This patient has eighth and ninth rib fractures. This is an example of subacute rib fracture. As you can see here, this is not associated with what we have seen here, pleural thickening, because this pleural thickening is an acute finding and will disappear on follow-up chest x-rays. So this case maybe at first has developed this kind of pleural thickening, but now has developed so this is an example of subacute rib fracture. If you compare this rib with this rib, can you see this rib? Can you see here? Kind of stepping. I would compare with old films, and symptomatic treatment is also recommended, but no further imaging required. In subacute rib fracture, there is no risk for development of pneumothorax, so there is no further imaging required, only symptomatic treatment. Why? Because in subacute rib fracture, the ribs are starting to heal by early callus formation. Can you see this kind of swelling? They start to heal by early callus formation. Now, this is an example of old rib fracture. Can you see this? This is the callus formation. So the third case, 42-year-old female with non-productive cough for several months. Okay, with history of falling down 6 months ago. So this is an example of old fracture. So if we start to count the ribs, this is the first rib, second, third, fourth, fifth, sixth rib, normal, seventh rib, can you see this stepping? There is fracture of the right seventh rib, lateral aspect, laterally. Can you see this and this kind of stepping? And if you go like this, you have to go like this to continue with the rest of the rib. Stepping. You need to go down to continue. Not like this. You need to go down to continue. Okay, so there is an old fracture of the right seventh rib laterally with Kaylas formation. I would compare with old film symptomatic treatment. If the patient is symptomatic, but he doesn't have any symptoms here, only cough, only non-productive cough. No, he has pain. Yeah, he has pain since fall 6 months ago. So symptomatic treatment is recommended here for the chest pain, but no further imaging required because this rib has already started healing by the Kaylas formation, so there is no risk of pleural injury. So repeated chest X-ray is not required here. No further imaging required.